There's a lot of back-end things that need to happen, not just improving the service level. There's a lot of admin hassle that providers have to do. It's not just providing better service for providers, HR, and patients, but it's also, can we use data and tech to really make the entire system more efficient and increase healthcare accessibility? When I say healthcare accessibility, it's not just population, which is more people having an HMO. It's also service and financial accessibility. Meaning, can we cover things like medicine, which is the number one out-of-pocket cost we discovered, but it's oddly not covered in a basic HMO plan, or mental health. It's such an important issue, especially after the pandemic, but you also don't get it in your typical HMO plan. And the third pillar is financial coverage. Liability is capped. The coverage is capped for health risk financing in the Philippines. Can you increase that cap so that when you get sick, you are truly covered and not just get a small subsidy out of it? That entails a kind of system overhaul to make the entire system more efficient and increase coverage and accessibility.
Welcome to Brave. Learn from Southeast Asia's best tech leaders. Build the future, learn from our past, and stay human in between. No BS on success. I'm Jeremy Ang, venture capitalist, serial founder, Harvard MBA, science fiction nerd, and dad of 2 daughters. Every week, we debate startup news, interview changemakers, answer listener questions, and share personal insights. Join our movement of over 40,000 members and get transcripts, resources, and community at www.bravesea.com. Stay well and stay brave. Are you a business owner, CFO, or engineering lead who's tired of grappling with outdated finance processes? Are you frustrated at the high costs of card payments or find yourself bogged down by manual financial tasks? It's time for a change. Meet Acme Technology. Our software enables you to connect directly with your bank of choice to automate all of your finance and payments processes. Enjoy real-time reconciliation and direct-to-bank payments and payouts. No lengthy integration. Transform your banking experience into a Stripe-like experience, all with easy integration through streamlined APIs. Learn more at www.tryacme.com. Hey, Camille, really excited to have you on the show finally after so many years knowing each other.
Thanks for having me, Jeremy. What an honor.
Yeah, well, could you introduce yourself real quick?
Awesome. Okay, so I'm Camille Ang. I guess in light of the theme of this podcast, I'm the CEO and co-founder of Hive Health. I grew up in the Philippines, born and raised in the Philippines, and really spent, in terms of education, took up management engineering with Ateneo, which I believe you'd had a couple of encounters with alumni from, and really spent a bulk of my career in something I'm really passionate about, which is public-private partnerships. So worked across McKinsey, government, and private equity with Macquarie, really looking into public-private partnership. And yeah, recently went to grad school, taking up an MBA and MBA in International Development with Harvard. And in the middle of the pandemic, changed the course of my career and got myself into tech and healthcare and basically started Hive.
Amazing. I also have to mention that we were good friends since I'm meeting you at a conference, I guess, at Harvard
Yes.
Business School. I think it was a lunch table that we
Yes.
had with our
It
little
was
club
the
sandwiches.
same night I met my now fiance.
I know, right?
But
What
I
a
remember
crazy
you
night.
and not him. For that night. Okay, John will kill me.
He's like, he's going to kill you. Well, Jonathan was a previous guest on the podcast as well, Jonathan Ang, so you can check out his podcast here. But also, I want to say, Camille, again, thank you so much for saving my 2 cats during the pandemic. We're going to say that.
Man,
You can lay
Jeremy, I will tell them one day how you left them in New York. In good
global
faith.
pandemic. Yeah, there we go. Yeah, we
Fair,
pieced out to
fair.
Singapore. We left them in an apartment, and then Camille and Jonathan saved them. There we go.
They were good fun.
Yeah, thank you. Yeah. So Camille, could you share a little bit more about what you were like growing up? You went to Ateneo. Were you like a partier? Were you very studious? Were you introverted? Were you extroverted?
I guess I would classify myself as very extroverted during that time, much more than I am right now. Yeah, I grew up in the Philippines, but came from very similar to kind of the Chinese diaspora in Southeast Asia. Came from a 3rd generation migrant Chinese family, so a lot of those family emphasis on education is important. A lot of the good stuff, but also a lot of the conservative stuff on what expectations are for women. My great grandmother still had lotus feet, where they would bound her feet just to stay at home. And I think she was the first one who ever had an education in her family.
Wow.
For our generation, we all have education, but there is, I guess, less emphasis in terms of like leadership and career for women, which was a little frustration for me growing up, but appreciate also like where they came from but also growing up, it was a figuring out which part of the spectrum I want.
Wow. And what's interesting is that you would eventually intern and work at different places, but really spend that time working in the Philippines government. Could you share more about that?
Yeah, that was a bit of a scandal internally. So I grew up in a private Chinese high school in the Philippines, and it was only in college where I kind of see a broader view of the Philippines and got to see parts of the Philippines and the pain points and poverty around in a deeper level. And Ateneo is a Jesuit school, and social justice is a big theme. And really bought into that, wanted to explore that. When I graduated, it was the Aquino administration. And suddenly, for the first time in my life, I saw a lot of like smart people from abroad, CEOs of companies joining at a 90% pay cut to really drive change. And at that time, the Undersecretary for Transportation invited me to join. And I was like, okay, I'll do this for 2 months just to see the pain points. When I'm 50 years old, I'll go back to government when I've already learned the things in the private sector. But after 2 months, I was like, hey, actually things are like happening fast. And the first project they gave me was the Mactan Airport, second largest airport in the Philippines. And they wanted to do a public-private partnership out of it. We were negotiating with actually like Changi was part of it and like different foreign players. And it was interesting because I remember walking into that office and there were so many feasibility studies of projects that never happened, but suddenly this one that I'm handling as a fresh grad seemed to have hope. So I was like, okay, let me try to stay for 6 more months. And then I stayed for another 6 months. And then I kind of stayed until the end of the administration where we were able to roll out things like the public-private partnership at the airport, other PPPs, projects. We were able to create the first ever, I remember Al Jazeera featuring this. We were the first ones who implemented TNVs, like Grab and Uber being legal nationwide, having the regulation for that. And it was like pretty amazing and one of the highlights of my career actually. And that was like interesting for me to prove assumptions wrong. A lot of people are like, okay, you'll join government. You'll just be eaten up by the system. You won't be able to do anything. And actually, I don't regret it any single day that I spent there. And I think it really not just helped the people that we were able to help, but helped me as a person grow as well.
Yeah, it's interesting because there you were at the Department of Transportation, really figuring a lot of this infrastructure, which is something that needs to be developed all across Southeast Asia. And what's interesting is that you went off to Macquarie and continue working on infrastructure and real estates. Could you share more about that?
I remember entering grad school and I was probably the top percentile of people who were like super, super sure on what they wanted to do in life. Ironically, didn't do what I set out to do. And I think, so my family's into real estate and I really admire my dad for building townships and whatnot and thought that affordable housing and infrastructure is an interesting space to be at. Learning about public-private partnerships, my plan was really to work with local governments to build public-private partnerships like bridges, townships, and whatnot from the private sector. And I thought infrastructure was really key because it's the multiplier effect. And growing up in the Philippines, I would see people who go to work for 15 minutes and people who would go to work 3 hours, sometimes 4 hours, and not even have proper transportation. And I feel like transport and infrastructure was like big metaphor for inequality in the country. And that was like an interesting problem solved. So that's why infrastructure was kind of my life hypothesis at that time.
Yeah. And it was interesting because now you're done the public side and now you're also doing the private side. What would you say was like the difference from your perspective?
Oh, interesting question. Yeah, I think from the public side, with proper political support, there's so much that you can do. One lever, you can cover everyone around you and really make crazy changes, but it takes time. Like you have to speak to like multiple stakeholders, and it's also possible. Like I've met a lot of people working on like a project for 12 years, 10 years, and it may not happen. But actually, if it happens, it's monumental. But from the private sector, it's much faster in terms of what the impact that you can do, because you can trigger change and scope out the impact that you want to make. But in terms of really moving the needle on a macro level, that would take more time. So I think right now, my view is it's a very personal choice and there is impact to be made on both sides.
Yeah. And then after that, you went off to do your Harvard Kennedy School and Harvard MBA combo. What was your thought process there?
So I wanted to do MBA, the Econ side first, International Development Program. Yeah, I wanted to understand the why of like, I took up management engineering, didn't have any clue on economics. And my hypothesis was like infrastructure would move the needle in terms of poverty reduction. I was like, okay, if I'm going to do real estate, it has to be affordable housing. So if I'm going to do anything in finance, it should be microfinance, kind of like the fringe social enterprise types. I was part of Gawad Kanina, which was a social enterprise initiative. So that was kind of my thesis, but I wanted to understand, okay, from a macro level, what really moves the needle in terms of poverty reduction? So that's why I wanted to do the MPID program. I didn't know it was like super technical and most people had like master's in econ. I almost died going through that. Thank you to all my classmates who helped me do all the coding and calculations. But I also wanted to do the MBA program because beyond like the theory, I wanted to know the how. Like, how can I take this understanding of what moves the needle and really take it into my own hands and try to implement something that's meaningful for intractable problems in developing countries, specifically, hopefully, for the region that I'm from, which is Southeast Asia. And there, I guess that's why I did it. I can share what I learned after.
Yeah, what did you learn?
A lot. The MPID program was super interesting. I remember there was this one class, Lat Pritchett, who started the program, came in and he showed this chart. He was like, the correlation of median income per capita and poverty reduction is 99.3%. And only, I think, 0.3% of poverty reduction was explained by non-food items. What that means is actually what really moves the needle is when you think of Korea, for example, are all these big businesses like steel, shipbuilding, the industrial policy that really drives the jobs and the median income per capita of people. But it's funny because in government and all these like non-profit kind of sector, sometimes the private sector is bashed or like, oh, all these big businesses are evil, but actually they're doing like a big role in society. But also I think personal realization was, yes, there's a macro of what moves the needle. And I joined the Rwanda Development Board to go into that industrial policy. Like Africa was the big source of the next poverty reduction next to Asia. But my realization was there's a big part of personal journey. I was like, why am I in Africa? There's so much to be done in the Philippines, Southeast Asia. Why am I doing industrial policy when I think I have no distinct advantage to be doing this versus another sector that's more meaningful for me right now? And then the MBA program was really helpful in terms of having an ecosystem of other people building different things like yourself and learning from the different founder stories and the professors and all the cases and realizing that there is not one successful path. It's what resonates with me more and trying that out and realizing that, hey, it's actually possible was really helpful for me. When we joined the Harvard Business School New Venture competition, that was such a faraway dream for me. I remember the only Southeast Asia company that won that was, I think, Grab with Anthony Tan 2011, which eventually launched it. And we even applied to this too much. But then like all your friends are applying anyway, so why not? And then so it's like those little things that you think like, why not? Why not? And until today at Hive, there's all these scary things. But then you have this mindset now of like, why not? Then just try it and implement things as fast as you can.
So curious because, for myself, I just did half an MBA and they used to call it the West Point of capitalism. So I was like listening to it, I was like, why do people say it? So I'm kind of curious because the Harvard Kennedy School feels like, the West Point of government. I mean, how did you feel? Were there any cultural differences between both sides?
Oh, huge. I think like what people value are like very different in terms of what we call the two sides of the bridge. I remember hopping on John's speech. They go through one class or another and the conversations will be so different, like what people are optimizing for. But I think it was like super complementary. Like on the Kennedy side, there's people who come from different parts of the country, especially the program that we did was international development, who was like implementing all these changes in India. People were like super, super passionate about education in Brazil or in Middle Eastern conflict. For me, coming from the Philippines, and most of my friends were like from the Philippines and coming from a family business, I guess, community, like HBS was more familiar in terms of making an impact is like giving jobs to people and creating good businesses. And when there's surplus, you give back. Government was not even, my parents were against me going to government. Like my dad is super passionate about helping people in terms of solving poverty as well. But the theory of change is so different. But then like you go to the other side of the river and they think, okay, what are the policies we can do? What's the economic model to really change things? Just last week, a friend of mine who had background living in like Peru, French friend, they're like, hey, this girl in the Philippines is working on industrial policy to meet me up with the senator here, and they get super excited about changing things from a more macro perspective. And like it's interesting seeing both sides because it's almost like the schools are a representation of like society as a whole as well and how people think about their views.
You mentioned earlier that it was like controversial to work in government, to study government studies. Could you share a little bit more about why?
Controversial for my family.
Yeah, I guess that's how you defined it, I guess.
Yeah, I guess it was more not usual. And I think they grew up in a different generation
Right.
where there's a lot of like being jaded and on what the government can do. And they also have heard of a lot of stories of joining government and you try to do good, but it actually bites you back. Because in government, there's little incentive to do things different. And that's what you actually need. And when you do things different, there's a risk that other stakeholders find something to put you down. So it was more out of love that my family was against it. But I think in the end, it's a part of it.
You just love doing it. Yeah. And what's interesting is that you took this time and now you are back, at least from my perspective, giving back again through an entrepreneurial route. You've decided to build and found Hive Health. Could you share more about that?
Yeah, I guess first what Hive Health is. So we're the first full stack health insurance company that provides easier to use, higher value, comprehensive HMO plans, health plans, specifically for small, medium enterprises. And really what motivated me and my co-founders starting it is on a personal level, growing up, I would have a lot of friends who would have someone in the family has a health shock and they wipe out their savings, wipe out their employer sponsored plans and really struggle to pay for their needs. And I always just thought that's the way things should be. But then studying in Boston, healthcare capital, and realizing that there's a lot of things that can be done in terms of health financing to improve health risk protection was really interesting, especially at the height of the pandemic. Me and Chao and my co-founder made this entire question into our thesis at Harvard. And we tried to answer why and how can we increase health risk protection for Filipinos. What we discovered is more than 1.5 million Filipinos go into poverty every year because of health shocks. And beyond the social health insurance, only less than 10% of the population have what they call HMOs, mostly large corporations. And the reason is a lot of these HMOs are built on legacy manual systems. So it's very expensive for them to reach all these small, medium enterprises. And what that means for SMEs is they get poor service and they get really expensive plans just because their number of employees are really small. So we thought, hey, that's where the pain is most felt. And when we started to think about it, it was in the middle of COVID where there was increased digitization and there was an increase in demand and greater quality care. So friends of mine who own businesses that would never provide a health plan before would be like, oh, I would lose an employee because they don't have a health, or my health plan is actually not up to their standards. So then because of this greater awareness and digitization and greater demand for quality healthcare, we saw an opportunity to build a capital market driven solution, i.e. a startup to try to solve this macro problem that we look at from a Kennedy School point of view and now are trying to implement from a more business perspective.
Yeah. You're serving thousands of doctors across the country. I think it's interesting because it's something that people really struggle with, obviously. What do you think are some myths and misconceptions about healthcare in the Philippines?
This is a misconception, I guess, of me also growing up. I always thought I had no concept of care coordination or primary care. In the Philippines, when someone has 7 different kinds of symptoms, they go to 7 different doctors. And my mom literally did this. She had a knee pain. She went to an oncologist because she had cancer. She thought she had cancer. She went to a cardiologist. She went to our pediatrician. She went to our generalist doctor. She went to I think 5 or 6 doctors. And we see this in our previous patients before we instituted our new care model as well. They would go to all these doctors and these doctors don't have their full medical records. So what happens is not only do they spend a lot of money either out of pocket or their health plan utilization, they also don't get the right standard of care because their doctors don't see their full medical history. So they get inaccurately misdiagnosed and overall bad health outcomes. So what we're trying to do at Hive and what we've built is beyond just making processes more efficient, like availing care instead of lining up in a hospital for 4 hours. It's much easier. We built an vertically integrated telehealth function with an EMR that we've built in-house as well so that our own doctors are able to see all your medical records from your annual physical exam to all your consults. So then they get a bigger, broader view of your medical history. And we kind of serve as a primary care function. So then your Hive doctor routes you to the right care and you're able to more efficiently use your health plan, more efficiently use your time, get a better standard of care for yourself and your loved ones.
Yeah. What's the interesting aspect is you're building a HMO. So most people don't know what a HMO is. It's something that I learned because I've always had a long interest in healthcare. But could you explain what a HMO means? But more specifically, People have always thought of HMOs in the context of the US, right? So what does that mean in the context of the Philippines?
Okay, let me in the context of Philippines because it's probably different elsewhere. So HMO and I guess healthcare, health financing in the Philippines is we do have social health insurance. It's provided by PhilHealth, but it only covers for inpatient care and the liability is capped. So let's say when you need cancer treatment, you only get say 8% of the cost of the care of the actual treatment that you need. And everything above that is out of pocket, which is why supplemental health plans are important, at least for the time being. I'm not sure when PhilHealth will eventually be able to cover for everyone's needs. I mean, that's the ideal goal. So supplemental health plans are important, but as mentioned, it's only available to less than 10% of the population. And what HMO means in the Philippines is before this whole industry was started by the company that we just recently acquired, supplemental health plans were reimbursement based. So you go to the hospital, you need a surgery, you pay it first, and then you go back to your employers, they pay you back. But that's a difficult model for the Philippines because a lot of people don't have like $200, $300 to just pay upfront. For some people, that's their entire salary already for the entire month. So then a cashless system is important, which is what the HMO industry tried to do. So for us, we have 60,000 doctors across the location, 1,700 clinics and hospitals. You can just go to those hospitals when you need it and you don't have to pay a single cent and you get the care that you need.
Amazing. And what's interesting is how do you go about building HMO, right? Because it's such an esoteric thing. Is it like in my head, it's like go to every doctor, get them to agree, or is it like go to the employers, you sign them up, or how did you go about doing that?
It's a two-sided marketplace. So on the one hand, you have all your clients, but on the other hand, you have all these valuable doctors and providers that you need to convince to join you in the system. And if you look at the HMOs in the country, they weren't built over time. So HEPI, which is the amazing company that we acquired, built it across 4 decades. And it took a lot of time for them to build that. So initially we partnered with them to really test out the tech platform, entry platform that we've done. But what we realized is, yes, we're getting all these customers and organic referrals, and they're really happy with the way that we change care available. But to really move the needle in terms of health outcomes, incentives of doctors and providers to give the best care possible, we need to be able to control the quality levers and have a direct relationship with all these providers. And that's why we decided to acquire the company. So now we are able to combine the tech and data of Hive and the 37 years of institutional knowledge, data, provider network that HPI has to really elevate the patient experience even further from where we are today.
And on that note, as you think about this, what is the growth approach? Is it like two-sided marketplace, get more customers on one side, get more providers on the other side, and just keep going? Is that the approach?
Yes, in a sense, but there's a lot of like back end things that need to happen. So there's not just improving the service level, both for providers. There's a lot of like admin hassle that providers have to deal with today. It's not just providing better service for providers and HR and patients, but it's also, can we use data and tech to really make the entire system more efficient and really increase healthcare accessibility? And when I say healthcare accessibility, it's not just population, which is more people having an HMO. It's also service and financial accessibility. Meaning, can we cover things like medicine, which is the number one out-of-pocket cost we discovered through our thesis, but it's oddly not covered in a basic HMO plan that you get. Or mental health, it's such an important issue, especially after the pandemic, but you also don't get it in your typical HMO plan. And the third pillar is financial coverage. So liability is capped, the coverage is capped for health risk financing in the Philippines. Can you increase that cap so that when you get sick, you are truly covered and not just get a small subsidy out of it? And that entails a kind of system overhaul to make the entire system more efficient and increase coverage and accessibility for people.
Yeah. On that note, could you share about a time that you personally have been brave?
I guess entering healthcare was a scary feat altogether. As I mentioned earlier, infrastructure was my comfort zone and friend real estate was my comfort zone. And that was my hypothesis. And I remember going to grad school and I told myself, I'll do a 70-30 approach. Like 70% is I'll go to conferences, attend classes, meet people in the space that my hypothesis is at. But I'll do the 30% just to see what's out there. And I remember healthcare was one of those random stuff that I would attend, like a random HBS healthcare conference that I know nothing about. And just like understanding how painful the process is and how big of an opportunity there is as well. And realizing that we may be the right people to do it. We, meaning my co-founder had a background in fintech and data science. I had a background in public-private partnerships and private equity insurance fund management and understanding of the market. Having that realization was scary because on the one hand, it was like, hey, we can do something about it. But on the other hand, we're outsiders in this industry. Can we really do something about it? But it was helpful to have a large community of people doing crazy things, both in the business side, like running all these crazy startups like yourself, and on the government policy side of people trying to move the needle and intractable problem in countries. So that was really helpful.
Yeah. How did you bring yourself up to speed and get comfortable with healthcare as a domain?
It wasn't overnight. I think people who were close to healthcare, like John, my fiance, was a doctor before and is into healthcare, was really helpful. So I think having a deeper understanding of the problem through different people, our thesis, and speaking to our various stakeholders was a good start. The second pillar that really helped us was being a school was helpful because it was a low risk way to iterate on our ideas, join all these competitions. But the real conviction that really made us dive was all the customer feedback that people value this thing. We're not just like providing a vitamin, we're providing like a painkiller. So something that people have been clamoring for a long time. And we haven't launched until this week, actually. We never went public, but most of our accounts have been through organic referrals of HR business owners that really love our product and would share it with other people. And that's really encouraging and what keeps us going. So I think two interesting stories is one, recently a patient of ours shared that she was diagnosed with a rare autoimmune disease. And I remember her quote, she was like, I needed to go through so many doctors, so many hospitals, and it impacted my overall health. But because of how Hive structured their portal and dashboard, I realized that I can spend just 1 hour doing all this versus spending 10 hours in the hospital. And that was a big help. And another story is someone who just reached out and shared that our mental health coverage really changed his life. So he wasn't sure if he had ADHD, and through our teleconsult, he was able to get a diagnosis that he actually had ADHD and was easily able to follow up, really checking if the med test worked, and it did. And he was sharing how it really changed the course of his life, being able to easily access this. Because you can try to want to reach out to a doctor, but if it's such a hassle to do, a lot of people just end up not doing it. And you spend 10 years of your life not being diagnosed and not living a life that's less optimal.
On that note, thank you so much for sharing. I'd love to summarize the 3 big takeaways I got from this conversation. First of all, thank you so much for sharing about what you were like as a student, extroverted, also with a heart for public service. It was really fascinating to hear your decision that was controversial at that point of time to work in the government, in the Department of Transportation. I also get a good sense of what public and private partnerships are, especially in the context of infrastructure and real assets. So really interesting to see that journey. Secondly, thank you so much for sharing about what inspired you to work at Hive Health, about your desire to improve health infrastructure and availability and access for so many Filipinos. So really interesting to hear not just about how you saw the problem, but also how you started to grow both sides of the market. Also about your acquisition of the Health Plan Philippines as well as part of your expansion. So really fascinating there. Lastly, thank you so much for sharing about your own personal journey, right? I really enjoyed hearing about some of the tough moments in terms of learning about healthcare. Also having the opportunity to learn from both the Harvard BA program as well as the Harvard Kennedy School program and be surrounded by such great folks about thinking about the future and changing lives. On that note, thank you so much, Camille, for sharing.
Thanks so much, Jeremy, for having me.
Thank you for listening to Brave. If you enjoyed this episode, please share the podcast with your friends and colleagues. We would also appreciate you leaving a rating or review. Head over to www.bravesea.com for member content, resources, and community. Stay well and stay brave.